It's 12:34:30. I was telling Dr. April Ritz, I told you 12:34:30, right?
Yes, and I didn't know what that meant. That's your guys' radio talk.
Brian, are you there?
Simple time is all it is.
Yeah, she was like 12:34:30. What is that? Is
Oh,
that a
yeah.
code for something?
Yeah.
No,
It's like 5150.
Yeah, that's right. But no, it's nothing about pelvic problems or anything like that.
No.
But we're going to find out about them right here. Dr. April Ritz back with us here on Facebook and on our radios. And how you doing this afternoon?
Doing great. Sorry, I was running in late.
That's okay.
Yeah, I had a
Busy
patient.
days.
Yes, that's why I normally don't do Tuesdays.
Oh, okay.
It's a busy time.
Yeah.
You guys helping out people left and right. So it's, if you put us on the back burner for a few minutes, it's A-okay with us.
Yeah.
Thank you.
All right.
All good.
It'll have to be, right? All right. Anyway, what's going on with you? I know you guys have been busy, but you're kind of taking like a week off from classes and stuff. Good
Yeah.
for you.
Yes, this week I actually don't think we have any, no evening classes this week. We do have screens going on this Thursday from 1 to 5 p.m. free screens. I think we have 2 spots left. They're 20-minute screens, but those filled up really quickly. For our 2-year anniversary for Effingham Pelvic Health and Wellness, we are doing a 4-part screen. So the first part is it's a questionnaire on pelvic floor dysfunction and symptoms that can play into that. And so far, all the screens we've had, everybody that's filled that out has been positive for that they are likely 91% likely to have pelvic floor dysfunction. So, I mean, people that are coming in for this free screens, though, typically know that they have some underlying issues.
Yeah,
so that doesn't surprise
Somebody
me.
perfectly healthy is probably not going to come in
Exactly.
for this. Yeah.
Yeah.
But if you're feeling a little different, might be time to hop in there.
Yeah, and it's a great way for people to, if they've been thinking about it, but they're really not sure this is something they want to do, it's a great way to come into our clinic and see our space, meet Lori, our patient care coordinator, meet myself. And then we're also checking their core for diastasis rectus, which is separation of the abdominal muscles. If they've had a C-section, we will check that scar mobility. I had a patient that had a baby sorry, I shouldn't say a patient, someone who came in for a screen.
Okay.
They had a baby several years ago, and they're like, I've always had pain in this area and some numbness and tingling. That's not normal.
I wouldn't think so.
So I assessed her C-section scar and gave her a little bit of feedback on that. And then I am also looking at the SI joint or the pelvic alignment for patients who have back pain. So far,
SI joint. Back to that. Where's that at?
SI joint is sacroiliac, so like sacrum ilium. So it's either the left or right side low back.
Okay, I got you.
So it's not, everybody thinks it's low back pain, which it kind of technically is. But I always say, is it in the center of the back or is it more left-sided or right-sided? So yeah, if you just would take your hand and like, I don't really want to, I'm on the radio.
Do
but
it.
So if you take your hand, put it behind your back, it's like right where your hand would fall here. I don't know if you can see me on live, but it's like here or here.
Okay.
Uh-huh.
So
hey, that's what we do these Facebook things for.
Yeah.
There you go. Demonstrations.
She did the hokey pokey and turned herself about. It was great.
But yeah, so those screens, we have a couple left this Thursday. And then on Thursday, November 30th, from 3 to 5 o'clock, we have a couple spots left there as well. And you can just go to our Facebook page, Effingham Pelvic Health and Wellness, to sign up for those, or just call our clinic and Lori can get you registered.
All right, very good. So, like you said, you got a couple of spots open there. Get there if you're having some symptoms. Maybe you want to wait till after Thanksgiving. Maybe you want to do it before Thanksgiving. Just get it done, right?
Yeah. Yep. Anytime. I always say you have to be ready, though, yourself. You have to be willing to put in the time to do some exercises at home, too. So about 15 to 20 minutes a day. So if you don't feel like that's going to be, that's doable for you, don't come and see us because you have to be committed to this process.
Yes.
Sure. Okay. Very good. And it also looks like there's another one on the 30th of this month.
Yes, this Thursday and then November 30th.
Like Flex said, following Thanksgiving. So there's another opportunity.
Maybe you eat all that turkey and stuff. You may need to get double checked. I don't know.
Yeah.
Could be other things, too.
Carrying around that turkey with you. That's not good.
Well, if you're on Thanksgiving and you're cooking in the kitchen and you start realizing you're having back pain and it's really
Yes.
bothering you, give us a call.
That's right. We'll see what we can do about that. Or if you got relatives who are a pain in the neck, will that work out?
Neck pain.
Or a pain in the butt. Come see us
That's
too.
right.
Yeah, so really, if we're talking about like, if you're up on your feet cooking a lot for Thanksgiving, if you have any pelvic heaviness issues, if you are laughing with family and friends and you feel like,
Whoops.
oh, I'm gonna pee my pants, if you are worried about where the bathrooms are, if you can make it in time, all reasons to come and see us.
Very good.
Those
Yeah.
are good
So,
reasons.
yeah, I mean, Thanksgiving, there was lots of people, and you better go to a place with at least 2 or 3 bathrooms because you don't want to be one filled up and it's like, I got to go. Hurry up. Get out of there.
Come see us.
All right. Very good. Okay. So you're helping people left and right. What have you been seeing lately on some of your patients? Anything out of the ordinary?
We see a lot of the same stuff over and over. Everybody's story is a little bit different though. So women and men, we've had a lot of overactive bladder and urinary urgency lately. We always are seeing pelvic pain as well. We always have our pregnant patients that are coming in too, and then postpartum. So a lot of people with like low back pain, pelvic heaviness, hip pain. Um, I have seen some patients this week with bowel leakage, in the bathroom, really controlling like where they're going and what time they can leave their home.
Sure.
And then I'm the one in the clinic who sees kids as well. So
Okay.
all the pediatric caseloads on myself. So whether that's bedwetting, bowel leakage, urinary leakage, or recurrent UTIs, just to name a few things. But Dr. Katie and Dr. Kyla see everything else, like the pelvic pain issues. Dr. Katie's doing more orthopedics as well. So just like neck pain, she's been dry needling a lot of patients for us with neck pain or pain radiating down the arm into the shoulders. I had a patient this morning who's seen her for 2 or 3 visits. And she said her pain is significantly better.
Oh,
She's able to
nice.
lift her kids, hold a coffee cup without pain radiating throughout her shoulder down her arm. So our clinic does specialize 100% in pelvic health, but we also see patients who are having pelvic health concerns come in the next week and all of a sudden their neck is really bothering
Oh,
them,
wow.
and we can treat that. So whatever is the primary complaint, we will treat that issue that day. It doesn't have to be like you came in just for your urinary leakage. We're not going to touch your knee, or we're not going to look at your neck issue. We treat all of it.
Yeah. And so if you're in a pain, you can fix most of the things there from there to there.
Yeah, from head to toes. Yeah.
There you go.
Awesome.
A
Yep.
host of issues.
Yep.
Toe problems. You run into many toe problems.
We
I hope
can
not.
treat teeth. We can treat toes. It is something we learn in PT school, but it's like turf toe is one of the things I'm thinking of, or bunions, things like that.
Yeah.
We can treat those, but it's definitely not our main focus.
Sure.
So I just sent a patient over to Indiana that they have like a foot, really well-known foot PT.
Really?
And so we're like, we've done our basics, but we think you probably should be looked at a little bit more. So we referred her on to a different PT that does more like just feet issues.
I like it that you see it. I could help you, but I know somebody who could help you even more.
Yeah, if we know a lot of basics with feet issues, but again, we don't want, if you're not getting better, we want you to get the optimal care. So if our basic treatments doesn't help you, we're going to refer you on to get the care that you need.
Very nice.
When you were in I think it was last week, you were kind of talking about and explaining nicely the differences on maybe, the treatment that you can offer on things versus what urologists can offer.
Correct.
Oh, yeah.
I think there's always that question out there, when do this, when do that? And I'm guessing you get that question quite a bit too on things related to OBGYN things.
Correct. Yeah. So a lot of gynecology, there's a lot of people that are like, they're going to go to their gynecologist if they have any issues. So it's like, when do I see, we've had patients say, when do I need to see you as a pelvic PT versus when do I go to my gynecologist?
Right.
So we say we like to work together. Unfortunately, though, most people are finding out about us from friends and word of mouth, as most doctors don't think about pelvic floor physical therapy as an option because they're not trained on that in school.
Okay.
Sure.
So I had a local OBGYN who actually came with me into the clinic and shadowed me for part of the day just to see. She's like, I kind of know what you guys do, but we were never taught this. So can I just observe you? And I was like, yes, please do. Like, I would love for any practitioner to come in and observe us for a day to get a better idea of what we are doing. So gynecologists, they are there for many important things. So like pap smears, making sure there's not cancer, any bleeding abnormalities, pregnancy, delivering the babies, testing for pelvic pain. So if a patient goes to their gynecologist for pelvic pain, typically they're going to look at what could be causing that. Is there like doing some imaging with ultrasound? Is there fibroids going on? Like what's underlying causing? But a lot of times the images and everything come back normal and you can't explain the pain.
Yeah.
So for physical therapy, what we say is if you're having pelvic pain issues and you have been dismissed by your doctor or no imaging can figure out what's going on, you're experiencing the pain. It's not in your head.
Yes.
Come and see us and we can help look at the things that testing like imaging doesn't show. So whether that's like the fascia, the nerves, the muscles, in imaging, if you have trigger points in the muscles or if the muscles are too weak, that's not going to show up in imaging.
Oh, yeah.
And that's what we as physical therapists treat. So we've had so many women that come in and they're just like relieved to know that yes, there is something going on and yes, this can be treated. For so many women with, especially like endometriosis, people go 10 years on average before they're diagnosed. And a lot of times, the only way to be diagnosed with endometriosis is to actually go into the abdomen surgically and look at what's going on in the tissue.
No kidding.
And that causes more scar tissue. So we are able to be hands-on with patients, looking at their abdomen, looking at their pelvic floor. We do an external and an internal exam for women and men. But that really allows us to get to those muscles and figure out what's causing the underlying issues. So I always say gynecologist is a great point to start with to rule out more serious things such as cancer and things like that. But what we offer is conservative treatment. We don't do medications. We don't do surgery, which is what you'd be offered if you go to a gynecology office. So some of the things that we also can help with that most people go to a gynecologist for, but I would say consider us, is C-section scar pain, pelvic heaviness, random pains throughout the day or even just a few times a month in the abdomen or pelvic floor, low back pain, really any pains, period pain, pain from endometriosis, interstitial cystitis, pudendal neuralgia, and pain with tampons. All of those things are not normal, and all of those things are typically coming from a musculoskeletal issue, so like the muscles. And so seeing us as a physical therapist would be a great place to start with those.
Did it, when the gynecologist came and shadowed you, did it kind of open their eyes to some stuff? Like, oh, very interesting.
Yes. She was like, it definitely did. She was really surprised by like the training we get on the pelvic floor and the individual muscles throughout the pelvic floor. Because oftentimes they're not thinking about the muscles. They're thinking about the organs, or cancerous tissue, like the endometrial tissue. Whereas we're thinking, when you're in our clinic, we're thinking about the muscles, the positioning of the organs, things like that. So she was like, okay, this gives me a lot better idea of what type of patients could benefit from therapy and what you guys all do. Because most people have no idea that we can help with issues in that area.
Very interesting. All right. If somebobody's out there listening to this and I think I need help, how's the best way to get in touch with you guys?
Yes. So we are on Facebook, Instagram, Effingham Pelvic PT. If you are interested in scheduling an appointment or learning more, call our office at 217-705-5077. And we did just create a Facebook group for women only. Sorry, men. We do see men too, but this is for women only in the Effingham area and surrounding like 90 to 120 miles.
Whoa.
So it's a private group. I have to admit you to get into it.
Sure.
But it's for pregnancy, postpartum, and pelvic health. So it's going to be a support group for our area of women. If they have just basic questions, they can ask their questions on there, share any information that they want. So we are just starting that. So that will be posted on our Facebook today too. So if you want kind of a free thing to get into and you don't want to commit to seeing us yet, that would be a great group to join, and it will be on our Facebook this afternoon.
Very interesting.
Nice.
Yes.
Awesome stuff. Well, very good. Well, thanks for coming in. Appreciate everything you're doing, helping out the Effingham area, and we'll see you again soon.
Perfect. Thank you, guys.
Stick around. More fun coming up. Brian Dust, talk to you on the drive home.